be pushed inferiorly or ventrally. Way back up here, there's another little ligament, okay, known as the pterygospinous ligament. Okay. It's going into, obviously, the pterygoid plate. Here we are again. So here's our condyle again. The articular disc, which is basically wrapped around, the thickest part wrapped around the condyle, and then there's the mandibular fossa up there. As I said, it divides it into two cavities with synovial fluid in each of the cavities. Okay. So there are several types of motion that can take place. Okay. The motion of when the condyle and the disc move together against the mandibular fossa, that's referred to as translation. So there's just a movement of the condyle in this sagittal plane back and forth. Down here, what happens is the condyle rotates about the disc. Okay, so the inferior cavity. So what between here is a translatory movement, as the condyle and the disc can move forward and backward relative to this surface. And in this lower cavity, this inferior cavity, that's where rotation, as the mandible rotates, as your mouth opens. Okay, movements here are affected essentially by this muscle, the lateral pterygoid muscle, which you're going to see. Unfortunately, while you see the lateral pterygoid, you're also going to basically have to remove it to find the nerves and arteries that are basically running through it. But realize that there's a lateral pterygoid. It originates on the neck of the condyle, right up at the front end of the condyle, and then the upper part actually goes into this articular disc, whereas the lower part is primarily is going into the condyle. Okay? And they extend anteriorly. Okay? So here's the superior part again, and here's the inferior part again. So for a small jaw opening, basically all you have is a rotation of the condyle relative to the disc and the head above, the fossa above. When you go into a larger amount of jaw opening, the disc and the condyle slide forward. There's the translation. They move forward onto this articular tubercle. And obviously that moves the whole mandible itself down. Okay? So small amounts are just rotation around the center of the condyle, but as you get past about 15 degrees, the head of the condyle and the whole mandible basically pull forward over this articular tubercle there. So there's a complex series of actions. It's not just a simple rotation. There's a little rotation and a little translation to enable you to have a wide gait. This is what the protraction of the mandible, moving the condyles forward, looks like. Okay, so when you pull it all the way back, the mandible's basically under the cheek, and you can sort of push the mandible forward. Usually when you open your mouth, which pushes the jaw forward. That's called protraction. And here's another one just showing essentially the same thing. Small mouth and openings and closing are mainly rotation, but large opening involves not just both rotation and protraction of the disc and the condyle up on this articular tubercle there. Okay. And the overextension of that, obviously too much protraction, because you've got there's this tubercle here. It's possible to obviously protract the mandible so much that the head of the condyle ends up in front of the tubercle. And then that's really tough, because it's got to come down and go back. But when it comes down, your jaws are clenching for all they're worth. It doesn't want to go back because it has to open before it can slip back in. and hopefully you won't run into too many of those. Yes?
I know that like eventually when people have TMJ, it eventually snaps. How do they fix that?
I have no idea. Sorry. TMJ is a real problem. I mean, even what causes it.
Yeah.
Okay. So basically, movement of the mandible relative to the cranium itself can take place in three planes. Obviously, the mandible can move up and down. Okay. It can move anteriorly and posteriorly. We just talked about protraction and retraction. And it can also move from side to side. When you chew, your jaw moves, has a lateral motion. It's not just all up and down, but it seems to. But you can see that the cusps move, the lower teeth move across the upper teeth. Okay, this is repeating what Dr. Fernandez showed you the other day, but since we're going to be seeing a lot of these muscles up close, I thought it's worth going over it again. So the big one on the side of the skull is obviously the temporalis. It originates in this temporal fossa here, inserts onto the coronoid process of the mandible, comes all the way down here. It basically closes the jaw. These upper fibers are going to pull the mandible up and rotate it up like that, but the posterior ones can also retract the jaw. The jaw is open and protracted. These posterior fibers can retract it a bit. Like all of the muscles of mastication, as Dr. Fernandez told you, it gets its innervation from the trigeminal part, the third part of the trigeminal. Okay, the masseter originates along here on the zygomatic arch, inserts onto the mandibular ramus, all the way down to the angle, but it has insertion all along this area here. So you're going to have to get rid of it to get into the infratemporal fossa, but take a look at it and see the fiber directions. When this thing contracts, it obviously closes the jaw. You can feel it. If you sort of clench your jaw, you can feel it. It protracts the jaw a little bit because you can see this origin up here is a little in front of the insertion down there. So it can pull the jaw a little bit forward. And I'll show you in a little, well, you can see it attaches on the angle of the mandible here. The zygomatic arch is laterally, so it can pull the jaw laterally. The medial pterygoid, which you'll get a good look at today, it originates down here on the angle of the mandible, on the opposite side of the masseter. Well, it originates on the lateral pterygoid plate, on the inside of the lateral pterygoid plate. It inserts on the medial side of the ramus and the angle down there, and it's just on the opposite side of masseter. Masseter's inserting in here, medial pterygoid inserting in there. Again, you can see it will close the jaw, and because the origin up here on the pterygoid plate is a little bit in front of the angle, it can also protract the jaw a little bit. And you'll have to, as I say, you'll see this, you'll see the medial pterygoid in the course of your dissection. You don't have to remove it because all the structures we're looking for are basically lying to the lateral side of the medial pterygoid. So you don't have to dig out and throw that away. The structures will all be on this side of it. And here's a picture of buccinator with a parotid duct slipping through it to go inside the mouth. And the one you'll see the most of today, the lateral pterygoid, okay, originates on part of the greater wing of the sphenoid and the lateral side of the lateral pterygoid plate. And as I said, it has a superior and an inferior part, and they go back and attach onto the articular disc and onto the head of the mandible. Okay, as I just said, when this thing contracts, it pulls the mandible forward so it can protract the jaw. It opens the jaw, and it can also, it's a little, you'll see in a minute, it can move the jaw a little bit laterally because it is not just straight in line with the direction of the mandible. So here's a back posterior view. Okay, so here's the medial pterygoids, which you can see are coming from the angle of the mandible here and traveling medially into this area between the two pterygoid plates on the inside of the lateral pterygoid. So when this muscle contracts, it's going to move the lower jaw and the lower teeth medially. Here's your lateral pterygoid out here on the side, and likewise, they have a fairly reasonable medial to lateral to medial direction. So in addition to pulling the condyle forward and helping to protract the jaw and open it, they can also move it a little bit medially or move the other side laterally. And again, all of these are innervated, as we'll see in a few minutes, by branches of the trigeminal V3. Okay, just to review, three main closers: temporalis, masseter, and medial pterygoid. One jaw opener, the lateral pterygoid, and gravity. Protraction, the masseter, lateral pterygoid, and medial pterygoid have a small protracting component, particularly the lateral pterygoid, and temporalis can retract the mandible because it has those posterior fibers. All are innervated by the third part of trigeminal, which we'll see in a few minutes. Okay, nerves in the infratemporal fossa. There's mainly trigeminal, we're going to see, find a lot of branches of that, some bits of the facial nerve, and a little bit of the glossopharyngeal. Okay, V3 comes out of foramen ovale and goes down into, here's your infratemporal fossa. Okay, there's little branches coming out here that are going into temporalis. There's lots and lots of muscular branches. Here's my label. So here's some muscle, deep temporal branches going out into there. Here it comes out.